Hi, everyone. Welcome. Thanks so much for joining us. My name is Lily Alexandrova, and I'm a postdoc in psychiatry at UBC and the coordinator for the Matrix N cluster, which organized this event. It's my pleasure to welcome you and to moderate this panel titled Career Paths and Translational Research. And to begin, I would like to acknowledge that UBC and Vancouver are situated on the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. I'm privileged to reside, learn, and work on this beautiful land. I immigrated to Canada myself, and I strive to continually educate myself of Canada's colonial history and to reflect on my own experience as a settler here. So I know that you are joining us today from many places, including near and possibly far. So I encourage you to take a moment to acknowledge the caretakers and traditional owners of the lands that you reside on. So before we dive into an insightful discussion with our panelists, I wanted to briefly introduce the Matrix N cluster, and Matrix N stands for Multidisciplinary Alliance for Translational Research and Innovation in Neuropsychiatry. And we are a university-funded research excellence cluster led by 5 faculty members within the departments of psychiatry and psychology, one of which is Dr. Tamara Vanderwal, one of our speakers today. And this initiative seeks to bridge gaps between research, clinical practice, and patient needs to facilitate innovative solutions to the overdose crisis and other global mental health challenges. We currently have over 70 preclinical and clinical faculty or trainee cluster members, and we're focused on facilitating multidisciplinary translational research collaborations. So I encourage you to learn more about Matrix N on our website or to contact us directly with any questions or with interest in joining the cluster after the event. Coming back to today's session, we really wanted to organize a mentorship session for trainees and early career researchers within the community to discuss different career paths relevant to translational research and medicine in and outside of academia. So it's my absolute pleasure to welcome our 3 amazing panelists today and to thank them for taking time out of their busy schedules to be here and to share their experiences. So we have Dr. Tamara Vanderwal, who's an assistant professor in UBC Psychiatry and a psychiatrist at BC Children's Hospital. Next, we have Dr. Stan Floresco, who's a professor at UBC Psychology and DM Center for Brain Health. And finally, we have Dr. Mounia Azzi, Vice President of Corporate Development at adMare Bioinnovations, a Canadian life sciences organization. So instead of going over their impressive bios, I'll let them introduce themselves. Yeah, so this session will be recorded. If you don't want to be recorded, feel free to turn off your camera. And unless you're speaking or asking a question, please mute yourself. Now I would like to introduce our amazing panelists today, and we have the pleasure of welcoming 3 amazing speakers and to thank them for thank you for taking the time out of your busy schedules to be here and to share your experiences. So we have Dr. Tamara Vanderwal, who's an assistant professor in the UBC Psychiatry Department and a psychiatrist at BC Children's Hospital. Hi, Tammy. And next we have Dr. Stan Floresco, who's a professor at UBC Psychology and the DM Center for Brain Health. Hi, Stan.
Hi, Lily.
And finally, we have Dr. Mounia Azzi, who is the Vice President of Corporate Development at adMare Bioinnovations, which is a Canadian life sciences organization. Hi, Mounia.
Hi, Lily.
Hi, thank you for being here and for sharing your experiences in your career journeys. So instead of going over each of their impressive bios, I'll let them introduce themselves further and take us down their diverse career paths. And the way this will go is we have a list of questions prepared for our panelists, and we'll leave 10 minutes at the end for audience questions. So please drop any questions you have in the Zoom chat, and time permitting, we'll get to all of them. So we can start. I'll stop sharing my screen so we can just look at faces, and I'll switch to speaker. Okay, there we go. So now I can start with the first question. So can you each introduce yourselves and take us down your brief career journey, including your education, training, and any work experiences that led you to your current positions? And we're particularly interested in any inflection moments that really cemented your career choice or research focus, or any unexpected detours along the way. So I'll open it up with Tammy.
Whoa, I get to start. So I was thinking about this question, and I was thinking I could give a very linear kind of direct response where I impose the narrative of how, I went to medical school, I got interested in research, and now I do this great combination of seeing patients and doing research. And it all sounds like it makes, beautiful linear sense, but that's not at all how it actually happened. So I think so first of all, I did university here in Canada, and then went to the States for a master's degree in ethics, which was in a divinity school. So I did that and then went to medical school. And then I did a 6-year training program there to do my residency and fellowship and get some more research training. So along the way, I had to choose to go to med school, but I'd wanted to do that since I was like in 4th grade. So that kind of made obvious sense. When I was in med school, at our school, we had a year where we could do research if we wanted to. So add a year to your med school, but you get to do research the whole time. And I did an fMRI experiment and sort of fell in love with the spatial aspects and the visual aspects of this research. And that really made me want to become a psychiatrist. It was more the research. I could have become easily a, pediatrician or an orthopedist. That was actually the one I wanted to do. And then made the choice to do that residency training just because I was interested in the research. And then from there, it just started to become more research and more research and more research. The two things that I think would not be obvious from that story are that one was what I call an RIM, which is a relationally induced move, right? So why did I end up going to Connecticut, which is where I lived for 20 years? Because I was married at the time and my husband at that time was studying there. And so that's how that whole story, happened. It's a life decision, not really a career decision, but very impactful on my career. And then the other choice I would say was deciding what kind of doctor to become. And this is something that I don't think we talk about very often, but it's taking into account like our own biological limits and illnesses or anything like that we have when we're making career choices. So I really wanted to be a surgeon, but I have an immune disorder. And so being woken up at 3 a.m. and having to be up at 6 and take call and do all of those sorts of things, even though I wanted to do it, I came to the realization that like, oh, that will suck if I have to do that. Right. And so that was kind of a big relief. And so all of a sudden, the decision to go into psychiatry, also because of the research, made a ton of sense. Right. So those are the two sort of like personal narratives that I would impose on the career development narrative. But yeah, so that's my story.
Thank you. And Stan next.
So I will probably give a slightly more linear characterization. So I grew up in Vancouver and I did all my training at UBC. I did my undergraduate degree here and almost failed out my first year. But it was in 3rd year where I started to get my act together and I got my first taste of research as part of an undergraduate stats course. And I loved it from the get-go. My first project looked at cholinergic modulation of memory in rats. And I just thought it was just the coolest thing. And so by the end of my undergraduate career, I applied to go to McGill, but my first year marks kind of held me back. So I didn't get, so UBC was my safety school. And it was probably the best thing that happened to me getting into my safety school. And I did my graduate work here with Tony Phillips. And by first year master's, I realized I really like, this is what I want to do for a career. I wanted the kind of academic route because I liked basically, you know, being able to kind of think about stuff and have the kind of freedom to explore whatever questions you may have about the brain. And so I did 3 years postdoctoral training at University of Pittsburgh, and then whatever kind of frontal lobe impairments I may have, I kept perseverating on Vancouver, and a job opportunity rose here, and I was able to come back in 2003. And I've been here ever since. And for me, I think it was that first taste of research that I got, and it's just something that really appealed to me, and that seemed to be within my skill set. That is like, I realized this is probably something that I want to develop as a career.
Thanks, Dan. And Mounia, as our industry representative.
Yeah, so a really non-linear journey for me. Thanks, Lily. And so I'm Mounia Azzi. I'm currently Vice President Development, Corporate Development at adMare Bioinnovation. I'll come back later on what we do at adMare. And so my journey, I felt in love, you know, for neuroscience in Algeria. This is where I born, so during my undergrad. And since it was not studied in higher grads in Algeria, I moved to Paris for my PhD back in 90s, studied there the potential of neurotensin receptor as therapeutic target to treat neurological and psychiatric disorders, moved to Montreal for my postdoc study in Michel Bouvier's lab, and then stayed in academia at University of Montreal for about 8 years in different positions. I wanted then to go and see what was happening in the industry world, so I was lucky enough to be recruited by Neurochem, a biotech company that was mainly focusing on developing small molecule inhibitors for the treatment of Alzheimer's disease back then. And we were at that time finalizing our IND package to enter clinical stages. So I joined Neurochem to lead the cellular pharmacology group, and I realized something very important that I was missing during my time in academia. And this is that as it takes a village to raise a child, it takes also a village to develop a new therapeutic and get it through the preclinical IND clinical stages and then to commercial products. So my team was working in close collaboration with medicinal chemistry departments, immunohisto, biochemistry, in vivo studies group, name it, and also, you know, with more advanced group, more clinical DMPK, biomarker safety, regulatory, patent, business development, etc. So a whole network of skills and specific expertise that were critical at all stages of development to analyze the data and really reposition the programs. So you were speaking about an inflection moment in my journey, and that was during that time at Neurochem, where I was part of a committee to evaluate and review potential new opportunities for both in-licensing and out-licensing of programs, and was therefore more exposed to the business development aspect of our field. And I realized after more than 10 years, so I'm slow, it took me some time, that I really love science, but I don't really love the pipettes. So I moved into, you know, what we name the dark side, and spent the past 15 years on the business and investment side, working in different translational and commercial organizations. So I worked as investment manager at MSBA Valorization, which is a venture capital firm, where I cover different aspects of valorization, investment process, including like the identification, evaluation, due diligence, etc. Moved to CQDM, a public-private consortium, aiming also at developing tools to speed up the drug discovery process, then Neomed Institute, and since the past 3 years at adMare Bioinnovations, where I lead a team responsible for all scouting, portfolio management, and partnerships. And we will come back later on what we do exactly at adMare.
Thanks, Mounia. Certainly very unique and different paths represented here. So happy to have you all. So our next question is, how do you spend your day-to-day in your position? What inspires you? What are major aspects of your job? What activities do you find enjoyable and wish you could have more time for, and maybe vice versa? And we can start with Mounia this time.
Okay, so just to, maybe so that you understand the context, because it's like quite different from academia, and I don't know how much you know about adMare, but in a nutshell, very quickly, we're focusing on three things. We build companies, partnering and investing in technology innovators and entrepreneurs, which are mainly academic researchers and emerging Canadian life science companies, and we provide scientific, commercial expertise, but also R&D infrastructure and investment capital to help build companies as they grow. We build also ecosystems. We have two state-of-the-art R&D infrastructure, one in Montreal and one in Vancouver, in the UBC campus. It was the former CDRD, where we house emerging companies as they develop, and we build talent, which is, I think, very most relevant for this audience. We have various academy programs, and I think the most relevant for you guys is the Bioinnovation Scientist program that we launched. We launched a new version recently. You can see all the info on our website, and it is a cohort-based training program aiming to help strong bench scientists transition into industry experts and entrepreneurs, providing them with commercial business, drug development, IP training, etc. So basically what most of my time is really spent on meetings. I meet potential partners, academic researchers, and newly established startups to hear about their great innovations, ideas, and science. I meet with our partners to see the advancement of the research projects and discuss the next steps to commercialization. And I meet with TTOs and commercial groups to negotiate and establish agreements. And of course, most of the time I meet my lovely team who is responsible for outreach, scouting, project intake, etc.
Thank you, Mounia. We can do Stan next.
So in terms of my day-to-day, one of the great ironies of the academic life, you spend the first 10 to 15 years of your career honing your technique in the lab and becoming just a really good scientist in the lab. And then when you reach the zenith of your career, you have to transition to being an administrator, which you get no training for throughout your entire graduate and postdoctoral tenure. So you have to kind of learn it on the fly. So like, you know, the typical academic scientific researcher, a lot of the time is spent doing administrative stuff, you know, managing, you know, meetings and stuff. I in the Department of Psychology, I teach as well. So I teach, you know, 2 courses. And so for part of the year, that takes a good chunk of my time. And serving on student committees and what have you. But the best part is when you get the free time to do the science and to write the papers and to write the grants. And I mean, for me, the favorite part of the job still is when we get a fresh data set and I get to dig into it and see what we found and start thinking about, you know, what the next experiment might be, or you know, how we might want to frame this particular set of findings in terms of broadening its scope. And so that's when a lot of that actually winds up happening in the summer when there's no teaching. So a lot of our productivity happens on that side during those periods. So that's what my day-to-day is. And I mean, the way I tell my civilian friends who are not in this business, it's basically you're running a small business. But unlike a typical business where you make a product, bring it to market, and you try to sell it, here you beg the government for money ahead of time. And then your product is knowledge that you know, build in 5-year cycles, but you still have payrolls you have to manage, you have personnel and that type of stuff. So it's a perverse business model, but it's something that still keeps working. So
Thanks for sharing. And Tammy?
That's such a good job description. I love it. Yeah, I would say pretty similar to what Stan outlined. For me, the favorite parts are grant writing. I actually really enjoy that because I'm very much an ideas person, and that to me is fun. And then when you get to see new data, right? If I could just do those bookends, like that would be the most amazing thing in the world. Although there are enjoyable moments in between as well. Meeting with students, looking at new data, working on their analyses, helping them to write, editing, a lot of editing, right? I spend a lot of time writing and a lot of time editing. Meeting with students and then collaborations. So for example, we have active collaborations with a group in New York and a group in Montreal, and a group in Paris. And so it's fun to have those kind of, you know, our lab kind of changes as we go. So we're having meetings with these different groups, which I find really enjoyable. And then one day a week, I completely switch my brain and become a child psychiatrist. And I see patients up north who otherwise would not have access to child psychiatric care. So I do all my clinical work through Zoom, but that was even pre-pandemic, and see kids, you know, of various ages with various different child psychiatric issues.
Thanks, Tammy. Yeah, definitely some overlap, but definitely a lot of unique aspects to each of your jobs. Our next question is, having walked this path and, you know, working in translational research, from your perspective, what makes a well-rounded translational researcher in neuropsychiatry or in general? What qualities and transferable skill sets are important and valuable? And we can start with Stan this time.
So I think if we're talking about translation in neuroscience and neuropsychiatry, I think for someone who does animal research, it's really important to kind of understand what kind of symptom clusters of a particular illness you're looking at and how to model them, and not just say, okay, and this is depression in a rat or a mouse or schizophrenia, but what are the actual kind of systems and perturbations that might be driving this particular symptom or that particular symptom cluster. I think the field is moving that way in terms of the kind of the research domain criterion initiative and breaking down illnesses based on their symptom clusters rather than you know, just black boxing them into different types of disorders. And so keeping in touch with what the human condition is like and realizing what you can and can't get to with a particular animal model, and not just the manipulation that you're doing that might be disease relevant, but particularly for our work in neuropsychiatry, because the only readout we have in these types of diseases are the behavioral abnormalities. There's no brain scan that you can do. There's no blood test for this. Is really kind of being thoughtful in terms of seeing how tightly you can kind of relate what kind of behavior you're looking at in the animal, that it might relate to the human stuff. And, you know, if you can, there are groups now who are starting to kind of do translation and back translational stuff, taking animal tasks and moving them back into the human, and seeing, you know, the similarities and or differences that you might see. I think that's kind of a key thing. I think also realizing that you can't solve everything, and then realizing your place in the field, and that if you're doing one particular thing, you are part of a larger scientific team. And I've always kind of been a fan of, you know, science is a team sport, and realizing that you don't have to solve all the world's problems or even a lot of them, but if whatever data you're providing may be useful at some point to someone else. One pet peeve I see as an editor for a journal and as a grant reviewer is when a criticism will come back as, oh, this is incremental. Well, all science is incremental. It's just the size of the increment that we're looking at here. And so just realizing that any new information is moving the field forward. And often, you know what, a replication, it can still move the field forward because, you know, sometimes these things don't replicate. So just kind of realizing your place as part of the bigger crew and just view it as a team sport, I think will make for a better, well-rounded translational scientist.
Thank you. What about from your perspective, Mounia?
Yeah, it's a very important question, and I will speak more to the skill set for a translational researcher in general. And Stan has nicely addressed some of the very important hard skills that are you know, very important and fundamental to develop for students. But I would include also the soft skills that are, I think, very, very also necessary for a translational scientist. And in these soft skills, I will include like problem solving, collaboration, communication, networking, innovative thinking, adaptability, all these kind of things that are very important, I believe, for an early career science professional, that they need to really develop not only their fundamental drug development knowledge, but combined with these soft skills to succeed in the commercial Canadian life science industry. So this is, something that we're considering at adMare, even when we are building those training programs, and we are taking them into account in, for example, our bioinnovation scientist program.
Mm-hmm. Thank you so much. That makes a lot of sense. And Tammy, from more clinical perspective?
Yeah, I would just add, I think translational work is almost always interdisciplinary. And so the skill sets that help that, I think, have to do with like things like communication that people already talked about, and openness, like an eagerness to be in teams. And you have to be able to think really clearly about your piece of what you're doing, right? So that you can communicate really well with other people. You have to be very solid and confident in your increment, right? And be able to talk about it in ways that other people understand. And especially when you write about it, you have to be able to write to a broader audience than your own like little niche. So I think that's a really important part of it. And then you have to like it. You have to like talking across, you have to like hearing weird things from the animal researchers. And, you have to like be into that. And it's not like your brain turns off a bit when someone puts up a slide that has absolutely nothing to do with what you do. That's fine. If that's your thing, then that's great. And like go deep and go do what you do. But that's, I don't think, a super good fit when you're trying to move the translational stuff along. And then I would just say, don't get all, I think one of our problems when we're trying to do translational research is like the hooray factor. Like we want to make an impact and we want to make a difference in patients' lives. I'm saying this as a clinician. That's all fine and good, but science is slow and science is small. And so you have to balance like your passion about that drew you to the translation with the methods and the rigor that we need to do these little pieces. And those little pieces are exciting, right? That's sort of what Scan was saying. So.
Mm-hmm. Yeah, thank you. So yeah, given, the research relevant skills and the soft skills and the passion, what are good ways to broaden one's horizons or to strengthen one's resume or CV as a grad student or early career researcher? Tammy?
Let's make Stan go first. He always has a better answer.
Stan?
Okay. How to broaden your horizons? I publish a lot of papers. I'm done. Tammy? No, I'm kidding. Well, the obvious ones, like, if you get the opportunity to go to conferences and be engaging with other, even senior researchers in your field, it can be a little intimidating, but I think you'll find often that the senior people like to interact with the junior trainees to a certain extent. There's always variability in personality types in this business, but I think being bold enough to go talk to someone, I think people will admire that. Another thing is, talk to your friends and colleagues in other labs and talk a little bit more about their day-to-day research. You can find, even at the same institution, two labs might have different ways of thinking about a particular problem, a concept, or what have you, that can really kind of enlighten you and broaden your horizons. And another thing, if your supervisor is amenable, I also find if you can get involved in the review process of articles, a lot of supervisors will, they get papers to review all the time. And if you kind of volunteer, I wouldn't mind reviewing something, getting insight to that aspect of the game, the publication game, and what it takes, how paper gets reviewed. And then you get insight in terms of when it's time to write your papers, what makes a good and bad paper. So you're not just seeing the final polished product that has made it through peer review, but you kind of see the incarnations of the different versions of the manuscript through that. I think that is, I got to review some papers early on in my career, and I found it made my writing a little sharper, and in terms of framing my arguments better in my writing, it really helped me out as well.
Thank you, Tammy.
And publish a lot of papers.
Yeah, I would agree. I think people are often, especially when you're early in your career, very hesitant to contact people. But like, if you have an article that you love, that you've read like 7 times, that you think is the coolest thing ever, send the corresponding author an email and introduce yourself, tell them what you're interested in, and you see where these things lead, right? It's totally reasonable thing to do. Also, if there's another lab, even if it's somewhere else where people are working on things that you think are really cool or that are related to yours, starting to get to know the students that are in that lab and setting up some sort of a thing with them is totally reasonable and doable and fun. And they're going to be your future colleagues. So you're already setting up those networks. And then my mentor always said, you got to find your wolf pack. Right. So you find your colleagues that, and they can be from anywhere, that you trust and that you like and that you get along. They don't have to be doing the same thing that you're doing. And you set up some sort of like support network. So you have people you can be like, hey, can you read this thing I wrote? Hey, can you, I have to apply for this, but I don't know how to do it. Have you done anything like this before? Right. Like they don't necessarily have to be doing your same work, but they're doing the same sorts of processes. And so I think that can, 1, broaden your horizons, and 2, help you in your own horizons. So those are a couple ideas.
Thank you. And Mounia?
All good points, Stan and Tammy. It's, I think, all very good advices. So basically, don't be shy and connect with your peers. I think this is very, very important. I think I can add to that, volunteer with university networking organizations, because you will, again, meet people with different views, and this is how we enrich ourselves, is really by connecting, by speaking with that have different views, different backgrounds, etc. Take on also internship opportunities. If you are an undergrad, take part in a co-op program. This is also one of the best ways to network and get to know people, not only in academic field, but also in industry. So you may see, what kind of things you are more interested in and you want to develop. So I think that, yes, network, go around and don't be shy.
Thank you. Yeah.
I'm going to add one thing, Lily, I just thought of. So a lot of the big conferences have different subcommittees, right? So like the one I'm a big part of is the Organization for Human Brain Mapping, and they have different committees and they have trainee spots on some of those committees. So you can be on those. All of a sudden you're having conversations with a bunch of lead researchers. You have something to put on your CV. Like it's a nice little stepping stone that's kind of built already there for you. So you can check your conference of interest and see if there's anything like that.
Yeah, great addition. Thanks for that, all that advice. Definitely, many ways and opportunities to enrich ourselves and take on, activities other than those related to our thesis. But, as we all know, many experience mental health struggles during grad school. So any advice on how to cope with pressures or maintain a healthy work-life balance, I'm sure we're all struggling with that. Let's go with Mounia.
Yeah, graduate school can be really overwhelming, and I know it. I have my 2 sons at home that are living this, so especially when the finish line, is so far away. I think one of the best way, and this is what I say to my son usually to deal with this feeling, is to set small goals. Setting small goals month by month can restore the belief that we've got this. So it can always be tempting to push on and not take necessary breaks, but this is, I think, more likely to result in feeling that that exhaustion. So self-care is very important. Getting sleep and physical exercise can help also refresh how we feel, encouraging so students to take time out. I know that, you know, sometimes it's tough, but I think it's important, especially at, you know, the weekend, being able you know, to return back to the lab refreshed, I think is very important, not only for a student, but also as a worker.
Yeah, thanks. Tammy?
Yeah, I think it's having a human brain is tricky at the best of times. And I think when you're going through demanding, difficult, and developmental transitions, it's tough, right? And there's all sorts of personal stuff that's obviously going to be part of your academic situation. So I don't know, it's a lot. I think a lot of students feel like they can't tell their supervisor, or that they don't, you know, they kind of would feel better if somebody at least knew what was going on a little bit, but they feel like it makes them look bad intellectually or something. I don't think that's how any of my colleagues, and definitely not how I feel. We don't think about it like that. We think about it like humans. We have these struggles ourselves. So if a student is having a tough time, I would just want to know that so we can help. And sometimes we make small little adjustments, right? And then all of a sudden it feels slightly more manageable, and that's all someone needs, right? So I think there's practical things that we can do a lot of the time, right? And so I think keeping it to yourself is not probably the best thing to do. So that would be my advice. Don't suffer in silence.
And Stan?
Yeah, I want to echo all those comments. I certainly think that in general, we've all become a little more aware of mental health issues and stuff. And there's not that as much of that potential for someone to kind of look down, or if you're saying, hey, I'm a little bit overwhelmed right now, particularly over the last 3 years that we've been through with the pandemic. I think we're all kind of a lot more sensitive to that issues. And yeah, so telling your supervisor and your support network, building that support network, that you know, might be issues, I need some time or what have you, I think is yeah, it's showing strength, not weakness, when you do that, and just knowing your limitations. And for a lot of these fields in science, a lot of our work is, there's like periods of very intense activity, and then there are periods where there's not as much to do. And I think you really kind of need to take advantage of those times where there's the lull in the work, and take advantage of the flexibility that this line of work often has compared to other types of jobs or what have you. And you know, as was said, you know, the self-care, and kind of when you've got a period, okay, you know, I don't have an experiment this week, take a bit of time and to yourself. And yeah, I also like the idea of kind of setting small goals. I have a task list that I have on my phone, and you know, I put, you know, things for the next week or two. And every time I complete a task, I press the button, it gives me this little happy ding on it, and that little conditioned reinforcer, that little kind of positive sound, just, okay, I did something, I achieved something. And I think just those little tricks, giving your brain just a little more positive encouragement, kind of helps everything more manageable. And then when you start whittling that task list down, you start getting, you know, it starts positive feedback on yourself until the next round of tasks come up, and then it's the vicious cycle that way.
Yeah, thanks for discussing this so openly and honestly. I'm sure we all need to hear these tips and tricks. So for the next question, I guess for Tammy and Stan, have you ever considered career paths outside of academia? And for Mounia, can you speak as to your experience of leaving academia and transitioning into industry? And for all of you, kind of, what are some key differences between academia and industry, some pros and cons that would be important when considering a future career path? And let's start with Mounia.
There are, clearly benefits in an academic career path that you will lose in the transition to industry. And I lived it myself, as an example, as an academic researcher, you get to follow your interest and really devote, your research time to pursue your own passions. Moving from academia, it becomes important to build like a professional network and stay up to date on industry news. You need to broaden and build like professional relationships, access, professional development, mentorships, collaboration opportunities. So you may need to take like heartbreaking decisions of stopping or killing a project, not because of its scientific or innovation interest, but because of commercial considerations. Because if the path, for example, to commercialization is challenging because of the lack of differentiation for competition, because of the lack of biomarkers to select the right group of patients, because of the high development costs that may be difficult to secure, you need to stop a project. And I lived that, many times of my life, even if the science looks gorgeous and you just want to pursue on that. So you need to be able like to say, okay, not for me, not for this moment. Someone else can develop that technology, but it will not basically be mine, even if I have the patience of that pathway, of that target, etc.
Yeah, thanks for contributing the industry perspective. And Stan?
So early in my postdoc, I had the opportunity to go give a talk and meet with people at Eli Lilly. At that time, they had a really intense academic style drug discovery group with people who would kind of do some of their own research and do some research for the company as well. And it seemed, really appealing. And they were saying, yeah, this is a lot like, so how is it? Well, there are the 7 a.m. meetings, and that kind of killed industry for me right there. I don't get out of bed before 7 o'clock. But it was also, the person I am, I really always appreciated the flexibility and job security that the academic life had. And I've had a number of colleagues that have gone into industry, and for a period of time, everything's great. And they're making more money than me. But then all you need is the corporate suits in New York to say, yeah, we're not going to do schizophrenia research anymore because it's not as profitable. And so we're just going to shut this whole wing down, even if there's some things that are going on there. So I think being at the whim of people outside of science and having your jobs, you could be doing really good work, but if corporate doesn't think it's profitable enough, then you can get let go. And I think, in academia, if you do your work, you make your committee assignments, and if you're a solid teacher, you can continue on to do that stuff. And I think that's what appealed to me about this particular life, and why industry, even though it's always an option for the type of work that we do, it was never something I wanted to do full time. We've done collaborative work with industry groups, but yeah, actually working in that things, I could be out of a job in 2 years just because corporates decide that. So that's why I kind of stay here.
And Tammy, what do you think?
I've never entertained sort of using science to do like going into industry. I think because maybe it's a bias, and these things are switching, I think, now quite a bit too. But I love that the intellectual freedom to hop from this kind of idea to that kind of idea, right? I feel like I'm not a good fit for developing something like long-term over time that could lead to a specific product or something like that. So I'm just too random, I think. I don't think they'd want me. And then, I've thought a ton about different jobs, like if I were to do something completely different outside of academia, but I don't think that's what you're asking about.
And I think what many of us don't understand, and I'm experiencing firsthand, is that, there are a lot of other jobs in academia that are not faculty positions or tenure track. There's a lot of other skilled, trained personnel that gets to support and work in exciting research. So yeah, thanks for sharing your perspectives on the difference between industry and academia. And I'll just ask one more questions from the ones we have prepared. For everyone listening, please feel free to drop yours in the chat. And everyone, thank you so much for sharing your wisdoms and staying on time. We're doing great. So yeah, this question, can you comment on any barriers or opportunities that might be unique to the current generation of graduate students or early career researchers versus what you may have experienced? And how can we best set ourselves up for success in the current job market? And let's start with Mounia, since maybe she's thinking about this a lot as training and the bio-innovation scientist program.
Our industry, I think, is really growing very, very, very fast, and opportunities are broad. We see a higher number right now of really stimulating, I think, positions that are open for graduate students, whether in academia or in industry or in any kind of other organization. And so if there is an interest to move from academia, I think I encourage really graduate students to be curious and to explore all the opportunities. Go visit, the translation groups, commercialization centers, biotech companies and CROs. All are doing like fascinating, research in different areas, different type of research, but fascinating also. So something I think maybe also quite new to the current generation is that most companies and universities now have programs in place to encourage equity, diversity, inclusion, and accessibility. And I would hope that we will see a new generation of graduate students and early career researchers that can access the funding and opportunities that they need.
Mm-hmm. Thank you. Tammy?
Yeah, I think it's a tricky time to be thinking about starting a career in academia. There's one, access to everyone's opinion via social media. So we now know that everyone thinks it sucks. And, that's a lot to take on when you're already stressed and you think the planet's on fire and you don't know if you want to do this really hard job that people don't seem that happy doing. So I think that I don't know if that's actually a new problem, right? That people feel like that, but I think it is something that is on almost all of the trainees' minds that I am talking to now as they get close to the end of their training programs. At the same time, there are stories like you're hearing today where our eyes still light up when we talk about the cool work we get to do. And so, I think making sure you're listening to both of those stories and that you're seeking out, opinions and input from people you trust and can be honest with you and ask your questions that really relate to what you personally care about. Ask those things when you're, trying to make these decisions and thinking about things. And then I think there are also issues with like publishing, like articles or things are changing, which until yesterday I was like really upset about, but then this amazing thing happened in my field where the top tier neuroimaging journal, all of the editors resigned because the journal company would not agree to decrease the fees, and they were using such a profit-driven model. And all of a sudden, I'm like so geeked out about publishing and so excited about being a part of a community that will do that. So I don't know. I think I don't think it's all bad. And I think there are that's a positive thing that's now happening. They're going to start a new journal. Like we're starting a new journal. It's going to be freaking awesome. Anyways, so those are some of the things that I think are shifting and changing and offer barriers, but are also not huge problems, I don't think.
Mm-hmm. And Stan, do you have anything to add?
Yeah. First, sticking just with journals and publishing, compared to when I was training, there just seems to be a lot more unnecessary pressure on not just publishing, but publishing in high impact journals, which as an editor for journals, that particular metric, the impact factor, is an antiquated librarian's metric that should not be used to make any kind of funding or hiring decisions and stuff. But there is a lot more of that. I think just publish a good work. And if your stuff gets cited, it doesn't matter how often a journal gets cited. And I think also it's just compared to what it was when I was training, it's just there's so much more information now, and it can be overwhelming. And I was just happy in my little niche of what I was studying. But now there's so many more techniques that are coming out every day that you've got to kind of keep up to date on. And so kind of managing your expectations and what you're expected to know, and not biting off more than you can chew is something that I worry about, the current generation of trainees. And it's like, just take it, one step at a time, and don't try to solve too many problems at once. And I guess the last thing in terms of the kind of the academic route versus other routes, it's like, the fact is not everyone is built for this type of work. It takes a certain personality type. And you may be a really good scientist, you may geek out on the science, but it just within the skill set that you have, the other things that go with being an academic researcher may not be part of your skill set. And that's totally cool, because there are other things you learn a lot in grad school that you don't necessarily think is a skill set. Like one minor thing that I always talk about, public speaking, right? Not everybody can do that. And that is such a huge skill. Like, we inherently, our brains are built to get nervous when we get up in front of other people. All right. That's just how we evolved to be, we don't want to, offend the group. And learning how to kind of manage your ideas and present them to other people is such a huge and important skill that a lot of people never get to develop. Or some people get up and public speak, but we see that they're not very good at presenting their ideas, or they're not presenting good ideas. Most of them go into politics. But for those of us who stay in kind of scientific realms, those of us who can learn to kind of refine our arguments, that can have a really big influence on many other people, right? And I think that's a valuable skill set that you hone in this training. So just as an example.
Well, thank you. Yeah, that makes a lot of sense, and highlights some differences that the new generation is facing. And the next question is a bit of a hybrid from questions that were submitted during the registration, as well as I see Rishika Dashwani asked a similar question. So the question is, are there ways to get into working in a hospital or clinical setting? In Rishika's case, she's interested in substance use disorders, but working in hospital and clinical settings with a graduate master's degree, but no PhD or MD. I guess, Tammy, since you're working in a hospital clinical setting.
Yeah, so I think, labs will post various positions where you could be hired with that level of training, and have interaction with patient subjects and all sorts of, be very much in sort of that clinical research overlap. So I do think labs are a good place to access the clinical world at that level. And sometimes there's like actual, good paying jobs that we all need. And then there's volunteer. I mean, we get emails all the time from people who want to volunteer, and there are mechanisms for people to join a lab and to be in a volunteer position. And hopefully that can, it needs to be worthwhile for the person, and it might lead to something. So yeah, I think labs are a good portal for that.
Mm-hmm. And Stan or Mounia, do you see a postdoc or PhD as a requirement for a career in translational research?
Not necessarily. I think, there's I think more room for advancement within the field if you have a higher degree, but I don't think it's a requirement. No.
And Mounia, from your...
Yeah, I totally agree. It's like, I think grades are important for your CV, but basically the experience that you will get, doing some training, the experience that your personality will make a huge difference.
Mm-hmm. Yeah, thank you. And we have one question from Denise in the chat, and it's directed to Stan. So she's going back to school. She did her in the school she did her undergrad in to do her PhD there. There seems to be this unspoken code about students not staying in the same school they previously went to. Looking back now, would you change where you went, or do you wish you tried a different school? Do you think this matters?
I was told that same rule that, you know, if you do your undergrad at a school, you shouldn't do your graduate there. And if you do your undergrad and graduate there, you'll never get hired there. And so that clearly doesn't always happen. I think that is an older rule. I think the reason, an unwritten rule, and the reason that was put in is basically to promote diversity of ideas. But in the grand scheme of things, and on a case by case basis, I don't think there's any, you know, drawback from doing that, because, you know, there are benefits to going back to a familiar environment in terms of one's own productivity. You can kind of start, you know, your work a little bit quicker. So yeah, it's not talked about as much now as it was maybe 10, 15 years ago. And I think that's a somewhat dated kind of way of thinking. Again, I do think that many students should go to other schools, because if you wind up getting in the same mindset, you know, ideas can get stale. I do know that my time doing my postdoctoral stuff, I learned things and learned to view things that I thought I was an expert on differently, and realized, you know, actually, I don't know everything about this. And so there is merit to going somewhere eventually. But, you know, going back to your old school that you did undergrad for graduate work, I don't think that's a problem at all.
Mm-hmm. Yeah. Okay.
Yeah, I would underscore sort of the personal side of that, and the sort of like intellectual creativity side of it. Like you want to have some sort of a different lens at some point, so that you're not just in one small sort of way of thinking. But that could come at any of your stages. You could do your whole thing at UBC and then go do a postdoc somewhere else, and boom, there you've got it, right? Or you could do a visiting professorship later. Like there's lots of different ways to add that diversity into your career.
Mm-hmm. And a question for you, Tammy, what are the benefits, detriments of being a clinician scientist versus a scientist in a PI position?
Very good question, and different depending on where you live, right? And so I think we have cultural differences within science and within academia, right? And so I was previously on the East Coast in the States. So I had both the Canadian American difference and the East Coast West Coast difference. Those things are all very pertinent to how people look at or think about clinician scientists. So, you know, there's not just one answer to that question. I think there are advantages to being a clinician. It definitely informs my work, right? Like I'm asking the questions scientifically that I am because of the clinical work and the clinical texture that I know about. So I value that quite a bit. I also, as Stan said, the job security of being a clinician is fantastic, and it does boost your salary when you're seeing patients, right? So that's a very real consideration. And I have a fallback that, you know, especially when I was in the States, where you have to fundraise, grant raise your own salary, right? That's scary. It's not like that in Canada. But when it was like that, I wasn't quite as freaked out as some of my PhD colleagues, because I knew I could always just see more patients if I needed to. So those are some advantages. The disadvantage, I would say, is time, right? It's a tremendous amount of time and emotional energy to see patients in and amongst your research duties. And at times that's very painful. You're excited about what you're writing, your brain's really in it, and you're like, oh, wow, I have clinic, right? So I find that to be quite difficult. Yeah, I think, and then also I would just say it's different training, right? So I'm definitely not as technically good at different statistical approaches or understanding different things that, you know, I would have been had I done an MD PhD, which I didn't do. So pluses and minuses.
Mm-hmm. Thank you so much, Tammy, and thanks, Morgan, for the question. And we have 1 minute left, so just any closing remarks or final words of wisdom, and we can start with Stan.
I think my final word of wisdom is I I tell trainees all the time when I go give talks that it's like, I think more than anything, you have to love the work. Because there are a lot of bad days in the lab. And every once in a while you get a good day to day. And if those few and far between good day to days kind of carry you through the bad days, then this line of work might be for you. Because there are a lot of other things you can do that you might enjoy more. So I think it all kind of comes down to having those bits of the job that you really love that can carry you through the parts of the job that are not as nice. And that's like every job is going to be that way. Every job is stressful. If you work the fry line at McDonald's during lunch, that's going to be stressful, right? So it's just kind of maximizing your skill set with your loves, I think is probably the best advice anyone can have about what to do.
Thanks, Dan. Mounia?
I think I have the same one. It's like, I can encourage everyone to be curious, be collegial, be ambitious, but remember to do what you love. This is it. If you do not look forward to going to work, leave. Please leave, because you are going to work for a very long time. So make sure that your role brings your personal fulfillment and happiness. So I think this is very important.
Thanks. And Tammy?
I would add that it helps to be sort of naively optimistic as a researcher. Like you kind of always have to wake up and think that, your idea is good. You might have a positive result. You might get a grant. Even if the world is telling you every day the opposite, like you kind of have to be slightly delusional. If that sounds like you, then this is probably a good fit.
Thank you so much. This has been so informative and inspiring. And I'd like to extend a huge thank you to Drs. Vanderwal, Floresco, and Azzi. Thanks so much. And big thank you to Marisha Boyd for helping me organize this session. And thank you all for attending and participating. We'll share the recording online soon. I hope you enjoyed it and learned as much as I did, and have a nice rest of your day. Thank you.
Thank you all. Take care.
Thank you,
everyone.